This video gives you as much information as possible about what to expect after surgery for your prostate cancer. You can have either the robotic-assisted radical prostatectomy or the open radical retropubic prostatectomy. The perineal radical prostatectomy is possible, but it is rarely being done. With any of these surgeries, the entire prostate gland is removed during surgery. In some cases, the lymph nodes in the pelvis and lower abdomen may be biopsied. For the robotic-assisted prostatectomy, you will have 5 to 6 small incisions in your lower abdomen. For the open radical prostatectomy, you will have an incision in the lower abdomen from the belly button to the pubic bone. For both, a rubber drain will be placed on one side of your abdomen for wound drainage. This is removed before you leave the hospital. You will want to be in the best possible condition before surgery. Get adequate exercise, eat a healthy diet, and take an iron supplement only if ordered by your surgeon or provider. Practice Kegel or pelvic exercises before surgery. Pelvic exercises are done to strengthen the muscles around the bladder and bladder opening. This will help with urinary incontinence after surgery. The exercises are done by contracting the muscle that is used to control the urinary sphincter. This contraction is also felt in the rectum and perineum, the muscles behind the scrotum, and in front of the rectum. 1 week before surgery, you will need to stop taking over-the-counter pain relievers, such as aspirin, ibuprofen, Advil, Aleve, naproxen, or prescription non-steroidal anti-inflammatories. Tylenol is acceptable to take as needed for pain. Also stop taking any non-prescription vitamins and herbal supplements. These may thin your blood and put you at high risk for bleeding during surgery. We will work with you and your provider about specific instructions for stopping other blood-thinning medications prescribed by your provider, such as warfarin, Plavix, or Xarelto. The day before surgery, you will need to empty your bowel of stool. The day before surgery, eat a light breakfast and lunch. This means no greasy meats and foods. After lunch, you will be on a liquid diet with no solid foods or dairy products. You may have clear liquids. For example, apple or cranberry juice, plain coffee, plain tea, sodas, sports drinks, broth, plain homemade Jell-O. At 2 o'clock in the afternoon, the day before surgery, drink 1 bottle of magnesium citrate. Magnesium citrate can be bought without a prescription in the laxative aisle. You may have any color or flavor. After drinking the magnesium citrate, you will have loose stools. Stay near a designated bathroom after drinking the magnesium citrate and do not travel. If you are traveling to a hotel the day before surgery, you should reach your hotel room before drinking the magnesium citrate. You may have liquids up until midnight. After midnight, nothing to eat or drink except for any medications you have been instructed to take with a sip of water the morning of surgery. Before going to bed before surgery, shower with Hibiclens soap. Do not wash your face or genital area with this. Take another shower using the Hibiclens soap before leaving for the hospital in the morning. Do not apply any products to the body, such as lotions or deodorants. The day of surgery, you will check into first day surgery in the hospital. First day surgery is located up the D elevator on the 3rd floor. Turn left off the elevator to first day surgery. Pack loose, comfortable clothes, brief underwear, a soft pillow to sit on in the car for the ride home. You should also bring any inhalers, CPAP or BiPAP machine, or glucometer if you have these. Leave any valuables at home. After surgery, you will be assigned a hospital room. You should leave your belongings in the car until you reach your hospital room. Immediately after surgery, you will have a tube in your arm called an IV to give you fluids and pain medication until you are able to eat and drink. An oxygen tube will be in your nose along with a clip on your finger to monitor your oxygen level. Elastic stockings and inflatable leg wraps will be on your legs to prevent blood clots from lying flat for a long period of time. After surgery, you will be shown how to cough and deep breathe to open up the lungs. It is important that you cough and deep breathe at least 10 times an hour while you are awake. You will be given pain medication to control your pain after surgery. You will be asked to rate your pain on a 0 to 10 pain scale. 0 is no pain, 10 is the worst pain you could have. You will be out of bed soon after surgery. Sitting up and walking prevents you from developing blood clots in the legs, opens up the lungs, and wakes up your bowels. You will be asked to walk 4 times a day and sit in a chair for each meal. We encourage walking after surgery. Once you are discharged home, it is important that you walk around the house several times a day for good circulation. Take several short walks during the day and rest when you get tired. You can climb stairs, but do not use this activity for exercise. It takes at least 6 weeks after surgery for a firm scar tissue to develop in both your wound and in the areas where you had surgery. If you engage in strenuous activities before that time, you may disrupt the delicate connection between your bladder and urethra. No vigorous exercise like swimming, jogging, running, golfing, tennis, biking, or fast walking for 6 weeks from the day of surgery. Do not lift anything heavier than 20 pounds for 4 to 6 weeks. Because of the location of the surgery, you will need to avoid sitting in a firm chair for more than 1 hour for the first 4 weeks. Do not ride a bicycle, exercise bike, motorcycle, or go horseback riding for 2 months after surgery. You may drive 2 weeks after surgery if you are no longer taking narcotic pain medication. At home after surgery, you may shower, but no tub baths or swimming while the catheter is in and until your wounds are healed. You will have a Foley catheter and go home with it in place. The prostate is wrapped around the urethra, and there is an incision to the urethra when removing the prostate. The catheter is placed through your urine channel into your bladder to drain urine while healing is taking place. The catheter stays in for 1 to 2 weeks, depending on the type of surgery you had. The catheter is held in your bladder by a small balloon. The balloon that holds the catheter in the bladder sometimes moves the tip of the catheter away or tugs down on the bladder neck, which may cause urine to leak around the catheter. If you notice leaking around the catheter, make sure there are no kinks in the tubing, urine is draining into the bag, and the catheter tubing is in a S shape. After your catheter is removed, you should wait 5 days before starting the pelvic exercises. After your surgery, we would like you to monitor the following things. Take your temperature 2 to 3 times daily. If it is higher than 100.5, call our office. Check the catheter bag for urine output often. If there is no drainage, you may flush the catheter. Your nurse will go over these instructions before you leave the hospital. Make sure your bowel movements remain soft. Pain medication is constipating, and daily soft bowel movements are important after prostate surgery. You will be instructed to take stool softeners as long as you are taking prescription pain medications. Nothing should be placed in the rectum, such as enemas or suppositories. You may have bloody discharge around the catheter or blood in the urine when you strain to have a bowel movement. Blood in the urine usually stops on its own. If your wound becomes red or has drainage, call our office. During the first 4 to 6 weeks after surgery, you must be careful of getting a blood clot in your leg. This can cause pain or swelling in your ankle, calf, or leg. If a clot breaks loose, it can travel to the lung and cause chest pain, shortness of breath, sudden onset of weakness or fainting, or coughing up blood. If you have symptoms or suspect a blood clot, you should immediately go to an emergency room or call 911. For any abnormal or concerning symptoms, contact the urology clinic at 608-263-4757. We are here to answer your questions.